Hi, I'm Dr. Erica Black with The Hearing Doctor. Today, we're going to talk about a big buzzword called tinnitus. Tinnitus, or ringing in the ears, is any sound that your ears are making that nobody else can hear externally. So sometimes patients report buzzing, ringing, roaring sounds. Tinnitus can even be music sounds. So you can hear all different types of sounds coming in your ears. And what's really sad about tinnitus is it hasn't been spoke about very much. A lot of patients come in and say, I went to my primary doctor, I told him about this ringing or this tinnitus, and they said, oh, yeah, a lot of people have it, you just kind of have to live with it. And that's not the truth. And tinnitus can be debilitating to many people, and there are options to help with the tinnitus. So let's first back up and talk about what is tinnitus and why is it there? Well, 80% of patients with tinnitus also have hearing loss. So if you have any history of noise exposure and you have that ringing in your ears, it's always important to get a baseline hearing test to see where that hearing loss is. For our office, when we test a patient who has tinnitus, we also do a tinnitus assessment. And a tinnitus assessment, we're matching the pitch, the loudness, and then finding how much sound needs to be used to cover up that tinnitus sound. So we do a couple of extra measurements to kind of see what that tinnitus is like. So why are your ears making ringing, or why are your ears creating that sound? Well, what's happening is as that hearing loss progresses, all of a sudden your ears realize you're not hearing certain pitches. So if you had just normal hearing and then it dropped off in those high pitches, you might hear some high pitch ringing sounds. And that high pitch ringing is your ear's way of letting you know, hey, I used to hear these high pitches and now I'm not hearing those, and I'm trying to alert you. So just like your body makes scar tissue and you get an injury and your body produces this scar tissue to try to heal, your body is trying to make the sounds it's missing. So your ears make that tinnitus sound thinking that they're helping. But anybody that suffers from tinnitus can attest that that sound doesn't really make you feel like you hear better. It's just more annoying than anything. So at least we know why your ears are making that sound. And what can you do about that? Well, two things that you can do that don't take the tinnitus away, but it might change how severe the tinnitus is. Sodium and caffeine are your worst enemies. Sodium and caffeine just irritate that organ for hearing and can make you produce more of that tinnitus. So it's not the cause of the tinnitus, but it's also what can irritate the ear and make the tinnitus worse. So really trying to back off that sodium and caffeine intake can help with the tinnitus. And then getting your hearing tested. If you need hearing devices, there's several devices that have options to help with just the tinnitus. So our patients that suffer from tinnitus, there's lots of options. There's maskers and all different types of things that we can go over. So if you have tinnitus or if you have more questions about tinnitus, feel free to call our office. You can schedule your initial consultation, or you can always ask us questions and we're happy to help. I'm Dr. Erica Black with The Hearing Doctor, where we connect people to people through better hearing.